Well, don't let me tell you more about that. I think that they'll do a better job, so don't go anywhere. Do you know the song? This is the Lashma song. Listen closely. But just in case someone is tuning in for the first time and just tuning in now, what is Ilera Eko? If you're a Lagosian, why is it important to you? Tell us a little about that before we head into the focus.
Oh, good morning, Lagosians. So, Ilera Eco is a Lagos State health scheme. It's like a social health plan for all residents of the Lagos State.
Okay.
It has been mandated by Mr. Governor, so everyone can partake in having a policy number. So that policy number, once it is activated, it gives you opportunity to visit the hospital where you don't have to make outright payment. So Ilera Eco standing as a third party, so whereby you pay a premium for a particular premium cost, your health is covered in any hospital that you choose, both private or government hospital, either which that you pick. Your health conditions are being managed in the hospital, courtesy of the premium that you've paid in Ilera Eco.
Awesome. And so we're going to focus on the Ilera Eco Standard Jara plan today. And like we have listened, I would say, tell us a little about what is available, because I know that in that play, people were saying, oh, they only have is for small sickness. So how big is the sickness that can hit you and you'll be under the Standard Jara plan and you'll be covered?
Ilera Eco Standard Jara plan is very robust. It's not just for small sickness, as it may, or as people might call it. So in Ilera Eco, you walk into the hospital, your registration is covered, general consultation is covered. You want to see a specialist is covered, general surgeon, a pediatrician, ENT surgeon, a dietitian, a gynecology for our women, it's very much covered. Family physician is covered, cardiologist is covered, orthopedics is covered under Ilera Eco. We also have what we call the annual medical screening. Okay. So whereby they check your urinalysis is very much covered under Ilera Eco. They do a physical examination, it's covered fasting blood sugar, total cholesterol, lipid profile test is covered, pap smear is covered. We also have the likes of the PSA for men, which is also covered under the Ilera Eco. So Standard Jara also comes with what we call telemedicine, whereby from the comfort of your home, you can actually speak to a doctor. You can walk into our V-booths. We have V-booths scattered across Lagos State that you can also walk into for checkup. It's covered if you are under the Standard plan. It's very much covered. You can speak to a doctor from the comfort of your home, and your drugs will be made available in any of the community pharmacies that is closest to you, where you can go for pickup. It's very much covered. What about cancer treatment? Some people may ask, is it covered? Yes, it's covered under the scheme. The breast, the prostate, the cervical cancer, up to a tune of 2 million naira is covered under Ilera Eco. Then some people will even ask, okay, for those that are pregnant, can they benefit from the scheme? Yes, it's very much covered for our pregnant women. Delivery is 100% covered. If you are delivering through CS, normal delivery is covered under the scheme. The governor is so particular about this particular one. So for our pregnant women, do not be afraid. Your antenatal, your postnatal is very much covered under the scheme. Your neonatal services like the circumcision, the ear piercing for the female neonates is very much covered under the scheme. What about children that were giving birth to through premature? It's covered for the first 5 days. Incubator care is covered under the scheme. What about local ambulance for if I get to the hospital and my hospital cannot attend to the issues, maybe it's complicated and they need to transfer me to another hospital, local ambulance is covered for that services.
Wow.
We also have dental care for those that will be asking, okay, what if I'm not the type that gets sick and all that? Why should I buy into the scheme? Wow, you can actually go for scaling and polishing. You can go for scaling and polishing of your tooth. For those that are having toothache, there is extraction of tooth that is covered under the scheme. We also have non-surgical extraction that is covered. We have dental X-ray. If you're having issue with your tooth, you don't know what the problem is, you can also go for dental X-ray. For those that are big moms and big dad that want to go for composite filling, is also covered under the scheme. So we have some other things that are covered under the scheme that we call like clinical chemistry, like your X-ray, your echocardiogram, full blood counts, malaria parasite test, genotype, resource factor, blood group is covered under the scheme. What about for chronic illnesses like people that have tuberculosis, asthmatic patients, sickle cell? Is it covered? They are covered under the scheme. Counseling of those people are covered under the scheme. Treatment of those people are covered under the scheme. The drugs are also covered under the scheme. What about our hypertensive parents? Are they also covered under the scheme? Yes, and refill drugs are also covered for them under the scheme in Ilera Eco. What about those that are on admission? Is it covered? Yes, admission is up to 15 days for each family member. So if you are 4 in your family, each family member is entitled to 15 days cumulative admission for a year, for a policy year. What about blood transfusion, especially for the pregnant women that will be needing blood? 2 pints of blood is covered under the scheme. So like I've mentioned before, I've mentioned diabetes, which is very much covered under the scheme. Family planning is also covered under the scheme. What about cataract extraction? This cataract extraction is what we added. Formerly, it was a standard plan. We didn't have cataract extraction on it, but on the standard JARA plan now is one of the benefits that you get to enjoy.
That's
Cataract
awesome.
extraction. Of course, we know some of these things comes with terms and conditions, especially the cataract extraction, which is covered under the scheme. So we have glasses also for those that have eye issues, and they are saying, is it covered? Yes, you are covered under the scheme. Glasses up to a tune of 10,000 naira is covered under the scheme. Treatment of minor eye ailments, allergy. We have what we call the conjunctivitis allergies, in the eye, parasitic ailment in the eye, they are all covered under the scheme. Removal of non-penetrating bodies is covered under the scheme. What about for those that have given birth to their children, childhood illnesses, to monitor the child, the feeding, the malnutrition and all that, to see a doctor and all, health education on that is very much covered under the scheme. What about common ailments like malaria, cold, typhoid, simple anemia, diarrhea, first aid treatment, and what have you, is very much covered under Ilera Eco.
In fact, right now, I'm like, someone's listening, like, sign me up, sign me up. How do I get signed up? How does that work? And I know you have categories. Oh, by the way, one of the things I really love that I know you didn't mention, because you've mentioned a lot of things, something excited about. In the month, if you are signed under Ilera Eco, in the month of your birthday, you can go and do a full body checkup at the hospital. That is awesome.
Yes.
That is awesome. Okay, so someone is like, sign me up. How do I get signed up? What are the payment plans, and who are they available to?
So the payment plan is available for everybody under the Lagos state. So for this particular standard JARA plan, we have the annual payment plan. So for all this, how much are you paying for all that I have mentioned? It is 15,000 naira for a year for a single person. So you can imagine a single individual having access to all of this except for the maternal care for 15,000 naira. Then what about the family? Family, all I've mentioned plus the maternal care is for 55,000 naira. We have family of 4 and we have family of 6. So the family of 4, which consists of the mother, father, and 2 children below 23 years, they have access to all that I have mentioned above. And also family of 6, we have the father, mother, and the 4 children that have access to all I have mentioned above for our premium. That's annually.
Awesome. That is awesome. I was just reading something earlier today about the fertility rates in the world dwindling. So when a woman is pregnant, especially whether you are single or married, once you are pregnant, you are under the 4 people plan, right? The family of 4 plan. And it's so important that if you're a pregnant woman and you're planning to be pregnant, that you are giving the best care. So I'm so glad that, Ilera Eco covers that. By the way, I know that the Lagos state government has said this is compulsory, but for someone who's listening, say, is it because it's when they hear compulsory, it's like, I will not do it again. Why did the Lagos state governor decide that, this is compulsory and I want to make sure it's available to everybody? If you could, shed light on that.
Yeah, so if one of the team of Mr. Governor is health, he's so particular about health.
Yeah.
So everyone can be covered, just have a health insurance. Because one thing with Nigerians is we are not so conversant with the word insurance. It scares a lot of people. And also another thing that we notice with Nigerians is walking into the hospital, they'll be like, especially if it's a big hospital, they already termed the hospital like, no, this is for big people, I won't be able to afford it and all that.
That's right.
So what insurance does for you is to include everybody, irrespective of your income strata. So that's what Mr. Governor had in mind when this insurance came about, so that everybody can be inclusive, no one will be left behind. And also the prices were made as affordable as possible, so that everyone can have access to quality healthcare services, irrespective of what you earn at the moment. Health is very, very important. So you can as well use a big hospital, use a specialist for that premium cost that you have made.
That is awesome. If you're just joining us, we are on the Ilera Eco show on the Super Pod. And we're talking to, she's a sales officer for Lashma. Lashma, not Lasma. Every time I tell you, it's Lashma. That is the Lagos State Health Management Agency. And she's talking to us about the Ilera Eco Standard JARA Health Plan. Now, for the premium to be paid, you've told us about that. If you don't have this service, the Ilera Eco service in your hospital, what do you now do? Like, you're already registered under a hospital right now, but you want to get on the Ilera.
Okay, so because it's a general review. This our hospital list. So your hospital may to ask to be on the plan. So
Okay.
we advise everyone to come on board. You choose another hospital. You could pick the one that is close to your choice, and you can change hospital twice policy year. So if you're not picking the exact hospital that you want at the moment, it could be added, in the following or subsequent months. So you can as well choose. If the services are not to your taste, you can always change your hospital.
That is an awesome development. By the way, if you're just joining us, hey, let me just tell you one
Exactly.
thing I love about this. If you can change your hospital in two hospitals in a policy year, that means that if you pay for the whole year, let's say you're an individual like me, I paid 15,000 naira, and so I've got my plan for the whole year. If I don't like the hospital I'm using now, I'm able to change it once more in the entire policy year. Am I correct?
Yes, ma'am.
Awesome, awesome. Okay, now the other thing I want to ask you about, just very quickly, I want to know about the older people health plan. If you can share, just shed small light on that for us.
Sorry, I didn't get you. Can you come again?
Older people, like our parents. It's not
Yes,
just for
yes.
young people. So tell us a little about the older people plan, if you can.
Okay, so for the elderly people, what we did is to carve out a special plan for them. So we call it the senior citizens plan. So specifically what we targeted in that is when it has to do with their tests, because we know they have special needs. So where
Right.
we are having seasons for the normal standard JARA plan, that is like the abdominopelvic scan that you're having twice a year under the standard JARA plan. When it comes to the seniors plan, you can be seeing like you're having it 3 times, as compared to what you have in the normal standard JARA plan. And also what you have in the seniors plan covers more when it comes to the annual medical check compared to what we have in the standard JARA plan, which is more like the basic plan. So it's more like an advanced plan
Oh
for all
wow.
citizens to buy into.
That
That's
is
the senior
so
citizens,
awesome.
especially.
Someone's listening right now saying, listen, sign me up, but how do I get signed up? What do I do? How do I get across to Ilera Eco? What do they do?
So if you want to register for the health scheme, we add different means to register.
Okay.
First off, you can register on our website, which is www.slashmad.com.
Okay.
You can also register in our head office. We have our head office at Good Shepherd House, opposite Secretariat Gate, Alausa, that you can register. I am also here. You can also call my number, which I'll be dropping at the end of this program, to
Okay.
register for the health scheme. We also have our divisional offices in all of the Ibiles, Lagos Island, Ikorodu, and all that, where we are scattered, that you can also reach out to if you want to come physically to the office to meet us. However, if you don't want to stress, you can register on WhatsApp. So that is why I'll be dropping the numbers at the end of this call. You can call, send the iMessage, send the WhatsApp message, place a call and say, I want to register. I am interested in registering for the health scheme. So the all of the benefit plan will be shared with you. The hospital list for you to make your choice will be shared with you. And also the e-registration form, that's the electronic form, will also be shared with you, so you can register, and the policy number will be generated for the person, after which the link for payment will be sent to the person to make payment, after which activation commences.
Very simple and straightforward. They send you information, you fill your information, you make payment, and that's it. And guess what? I know for a fact that you as a staff does not collect cash from anybody, right?
No, Lashma operates in no cash policy. You are not expected to pay any amount to any staff account or give anybody cash. There is a
Awesome.
link for payment. It is easy. It is stressless. For those that want to go to the bank, it is also easy. Just like you are paying your e-bills, NIMS platform, you go there, you tell them you want to pay for LSHS. You collect your teller, so you know this is your proof of payment. You don't have to pay to nobody, please.
My sister, Ruth Joseph, you have said more than enough. In fact, there are some things I didn't know that I now know. This is beautiful. Please call out the numbers that people can reach you on. If you have a complaint, you have a question, you have a concern, these are the numbers to reach Ruth and the team on. What's the number? What are the numbers?
090
Okay.
60 76 7938. I'll call it again. 090 60 76 7938. So for those that might have complaints and want to, hospital issues, and you feel like you need somebody to talk to and all that.
Okay. Is there any
Yes.
other WhatsApp number they can chat for any further questions?
It is also a WhatsApp line, so you can always chat it on WhatsApp. You can say
Fantastic.
hi, you can send a message on WhatsApp. It's very much available.
So if you
I can see so many people already calling and all
Ah,
that.
you
Yes.
people should calm down. Let her finish. So, if you are under the plan already, you have questions, you have concerns, whether it's about the hospital or a care that they render to you, it's important that you get back to the Ilera Eco team. If you are served right, they'd like to hear your good news, your testimonies, and if you are not served right, they would like to hear your complaints so that they can address them. Okay, the number again is 0906 070 7938 0906 070 7938. Thank you
I think
so much.
you missed the number.
I did.
It's not 070. It's
0906 070 7938. Call it again.
Oh, you're correct. You're correct, ma'am.
Okay,
Sorry.
I called it the right way. 434. So 0906
right.
070 7938.
Yes,
That's what
you're
threw me
correct.
off. Awesome.
You're correct.
Thank you so much, Ruth Joseph. You've been wonderful. Thank you so much for coming on board and talking to us today.